At Henry Ford Jackson Hospital, Wendy Kim. Welcome to the show, Wendy.
Thank you.
Nice to see you.
I know, it's been a little while since I was last here.
Yeah,
I was recalling the last time I was here, I think I still had a mask on. So,
wow.
Yeah, so I think it's been, a few years back. So, yeah.
Well, congratulations in your new position and appointment as interim president.
Thank you.
And I think it's about, 6 months now in for that?
Yeah, started around July.
Nice.
And so, yeah, still
How's it
going. It's going great.
Yeah.
I mean, people always ask what brings you to, work and what gives you purpose. And it's really the people. It's the people and the culture that we have at Henry Ford Jackson. So it's amazing. We had a leadership retreat yesterday, and just to see the engagement and the passion around always looking for ways to improve and looking for solutions. So yeah, it's been great.
Well, I think so too, and I agree. We have a great team of healthcare providers at Henry Ford. And there's several things I like about you in this position. One, you're a clinician. You came from healthcare as a provider. And two, you live here.
Yes.
And I think that's great.
Yeah, I was the chief nursing officer for the last 10 years, and I've been with the organization though 13 years. So, we always think about succession planning, and so I have someone in my role currently as an interim. So we got a lot of interim going, but it's people that live in this community and who are just passionate about making this the best, greatest place to be for our community.
A lot of advances and improvements and growth in the past year. What are some of the highlights?
Well, once you came, when it was during COVID, we received our first designation for Magnet, which is a nursing excellence. But really, it's a team excellence. It's about the interdisciplinary care and collaboration that we do united as a single team. But it really does recognize nursing excellence. So we received a redesignation. But I think the first time it was during COVID, and you actually came to the hospital.
Yeah, it was really neat because you had the independent organization reach out to the community and interview people from all walks of life about the healthcare and the service and the treatment and the people and the facilities, everything. And it was a real deep dive, and I learned a lot. But I think the one thing that most impressed me was the passion that everyone had, and some of the unbelievable stories about the care that they've received as a Henry Ford patient.
Yeah. So, designation too it's a rigorous process, and it's voluntary. You invite those individuals and those surveyors to make sure we've met or exceeded those standards. Some of the other things that we've been able to accomplish last year, or in 2025, can't believe it's last year already, was our gold seal of approval from the Joint Commission on our orthopedics program. Again, you are voluntarily participating with these types of programs, but you're inviting them in to demonstrate, that we're meeting the tough standards that are set in those programs. It's not an easy thing to accomplish, and it takes a lot of work.
And it's become a regional hospital. We grew up, for most of us, this was the community hometown hospital, but over time it's expanded to serve a larger area and become a magnet, really, both for the care in so many disciplines, but in trauma.
And a level 2 trauma center.
That's something that doesn't exist for hundreds of miles.
Correct. The other thing we've achieved is, and I think this is just so vital to who we are around quality and safety. And most years, we've achieved the Leapfrog A safety and quality rating. You get rated twice per year. You get that grade score twice a year. And so we continue to excel in that. And the teams are always just so attentive and looking at the quality and the safety and the high reliability to make sure we just deliver on that.
Have you been able to expand or grow any service lines in the last year?
Yes, we have, and we continue to invest in that and recruit in that. Heart and vascular, heart in particular, and I think that they've been on your show in the past. We have a new surgeon here too, and so we continue to look at, you know, structural heart, and, you know, we're looking at the complex care, right? And what we can bring locally to our community so you don't have to travel for that. And we have skilled and talented providers who can do this right here in your community, yeah, in our community.
Yeah, the hospital's pretty busy right now, isn't it?
It is. We've had a lot of respiratory illness, so yeah, we're not immune to it here.
We have a number of things that you do that, unless people aren't a patient, they don't realize it. Like, so you want people to get well rested, not just your team, but the patient. What's the experience like when you're a patient?
Well, we've heard from our patients, right, that, and there's a lot of disruption. Their care is ongoing. But what we've tried to do is pause in the afternoon from 3 to 4. We make an announcement, dim the lights, and, you know, we laugh, use your library voice as we've been taught as kids, right, growing up. But just to, you know, tone it down and try to slow down the activities if we can, just to give them some rest. You know, they come in and they're ill, and we're trying to, you know, make improvements for their health, and but it can be disruptive too to healing. So we're trying to do that, and then, you know, we're still announcing the evening hours of rest, and I think, you know, we want to be there for our loved ones, but, you know, they're not feeling well. That's why they're there. Yeah.
I think COVID changed, you know, a lot of things, really everywhere, and particularly healthcare. And before COVID, I think people just felt like they could just walk in and walk around the hospital at any time of day or night. It'd become a little bit more structured. Yeah,
you're right about that. I think, you know, with that pandemic, it did change things, and it did bring to our attention, you know, it's a place where, you know, you really don't want to bring in your littles, you know, unless it's, you know, a different point in the individual's life or lifespan. But, you know, you do try to monitor that just so you can create that healing environment and keep everybody safe too.
We're seeing some improvements in delivery of care, and one is in virtual acute care. How's that working?
You know, we look at different models of care to try to enhance the patient experience, but to also supplement our staffing and to help offload some of that burden that is required at the bedside. And so we have what we call virtual acute care. It is a nursing protocol and process. So we have nurses, and if you've ever been a patient, or somebody probably on the viewing has been a patient and has experienced it, but there is a camera in the patient's room, and the nurse is in another room, and it's a two-way video camera. So a doorbell rings, and they ask for permission to come into the room, and so you can see me, I can see you, and so we can do some of that administrative burden for the nurses that are at the bedside. So we can do admissions and discharges and patient teaching and education. We can do safety rounds. So we can go into the room and make sure that the bed is in the low position and the bed is locked and the call light's within reach to try to prevent falls, because we get confused when we're in a room that we're not familiar with. So, you know, I was looking at the stats before I came here, and we've touched around 5,000 patients since we went live in September.
Really?
Yeah,
wow.
Yeah. And we've given back, for each patient, we've given back that bedside nurse around 30 to 35 minutes of time back with that patient, where they can be hands-on and really, you know, make that connection with the patient. So, you know, we're looking at the technology and what it can do for us. And there's ambient listening, There's LiDAR technology, which I'm no expert at all the technology, but it can scan the room and learn the room, and it can help us to prevent falls. It can help us to prevent pressure injuries. So there's just so much that we can do with this technology. And yeah, it's just, I could go on and on, obviously, about the benefits of it. And then we also have ICU level of care virtual. So we have additional providers at night in a command center, similar to where our nurses are. And they're reviewing the records, they're helping the providers, so it's a consult. So it's just added providers and added care.
Yeah, the access to providers, it's so different. You know, even with my chart, you're able to have a conversation with your general practitioner, your family doctor, or your specialist, where 10 years ago it was, no, you have to come in.
Right.
We have to, you know,
The telehealth, the telemedicine now that we have, yeah. And, you know, even in this virtual acute care model, we're looking at how we optimize it, and we can do consults. So let's say you have a loved one in the hospital, but you can't get there in time for when the provider's going to be there. We're working on solutions so that you can get in on your phone and you're still in the room with your loved one and the provider while they're talking, you know, with your loved one. So there's just so much out there and possibilities on connecting.
Yeah, and that's really great when you're, you know, you've got someone, a close family member that might be, you know, 600 miles away.
Right.
And,
right.
you know, you're panicked. You've got, you know, a loved one in the hospital.
You want to be there, and so you want to ask the questions. And
I see a lot of Henry Ford people on the campus at Jackson College and Spring Arbor University. I know you're partnering with both to get people trained for nurses, and as a nurse, you must be excited to be able to be part of programs that are home growing our own nursing
our
force.
local colleges and universities are really our pipeline, you know, and so we do partner with them, and it's a great partnership, and you know, it's members of our community. You know, my own bonus daughter, as I call her, my daughter is in the nursing program too, so she's picked that up from mom, that's probably the career and pathway she wants to go. So.
Awesome. Well, you set a good example.
Yeah, maybe so. Maybe so.
People, nurses and teachers, they're usually it's because of someone that mentored them or treated them or taught them that caused them to follow that career path. Well, it's always great to have you here. Thanks for being part of Wellness Wednesday today.
Yeah. Well, thank you for having me.
The interim president at Henry Ford Jackson Hospital with us today on Wellness Wednesday, Wendy Kim. Lots more to come on